What's going on, Christian? What's going on, man?
Good morning, Eric. It's good to be back. I think I missed the last 2 weekends with the birth of our son, so it's been pretty fun adjusting to. So pardon my sleepiness.
Yeah,
Overall, like
congratulations,
everything,
dude.
overall everything's going really well. So I'm just happy I
Yeah,
can get some time to do this. Yeah,
absolutely,
how are
man.
you?
No, congratulations to you too again. That's awesome.
Thank you.
Very happy for you both. No, yeah, things have been good here. Woke up this morning, negative 18 outside. That's without the wind chill.
It's
Um,
without the wind chill.
yeah, it's negative 18. I don't know. It's actually not that windy out, so it's probably the wind chill is probably only like in the negative 20s, but it's still chilly.
Yeah, I don't miss that part of the
Still
Midwest.
cold.
We don't really have that problem here in Maine.
Yeah. Yeah. You got that nice ocean out
Got that
there.
nice ocean.
But
But hey, well, there was some good news. Not good news actually. Some like very unfortunate, stupid news that TJ Watt had a pneumothorax from dry
hmm
needling. Is that correct?
I know, yeah, dude. It is. Per sources around the NFL. Yeah. It's yeah, it's crazy. I don't like I thought about this before. When you're dealing with that type of an athlete, and you should deal with this, you should think about it with every single person that you dry needle. But especially someone in his position, when it comes to doing something like dry needling and you know that there's risks involved and how you don't make sure you don't roll into that one, I don't know. Like, as the practitioner, how do you not just triple check 3 times that you're doing the right thing and putting the needle in the right spot? So yeah, that was wild to read about, and it's hilarious and fun to watch people come out of the woodwork on social media and bash dry needling. Which, I mean, I hear them, dude. I'm not saying they're wrong in what they're saying about dry needling and in respects to the risks and whatnot.
Yeah. I'm not that PT. I don't know what was going through their mind, but I just think like if you're dealing with such a high profile athlete, for
hmm
one, it's a human being. It's like rule number one is do no harm. But then like you add layers to that of a high profile athlete who you're really not trying to mess around with, and you go and you get their lung. Like, what are you doing over there?
Yeah.
You shouldn't be doing that. There's too much at stake.
hmm
Like they're towards the
I
end of their
mean,
season. Like there's you're not messing around with more risky things. And like to be
right.
clear, the risk of a pneumothorax, I think, is somewhere it's below 0.1%. It's like 0.01%. So is that 1 in 10,000?
It's
Needling
super
things you're
low.
going to do is going to get a pneumothorax, but
hmm
only if you're over the lung field and only if you're doing more risky techniques, which I do needle over the lung field, but I don't do those kinds of techniques that are likely to have a possibility of doing that. So like this person, I don't know what
hmm
the hell they were doing.
Yeah, I don't know. It's a crazy. I mean, think about like. I mean, he probably makes. I don't know exactly what his contract is, but like, I'm guessing he makes somewhere between like $1 to $2 million a game, right? I mean, he's probably what like a $30 million a year player, I'd say. And so it's like, if they play 17 games, he's making probably like $1 to $2 million a game. And like, if you were the person that did that to him, let's say he's out for I don't know, 4 games. He's out for like a month or something recovering from this. Like, just costed him $5-7 million.
You're probably out of a job.
That's a $5 to $7 million needle that you just placed wrong. That's what that is.
Yes, yes. And I just hope they didn't do both
Anyways,
sides the same exact way. So you're gonna do it, just do one side. You can't do both.
all right, yeah. Well, good thing is a pneumothorax is not a death sentence, so it can be dangerous if not treated right away, but it is something that's treatable. Um, that's good. Anyways,
Yeah, it'll buff out.
but
But I'm not gonna
to
stop
go.
dry needling because TJ Watt had a pneumothorax. I'm just gonna make sure I keep doing things that are less risky.
Yeah, right. Yeah. I'll stick to my hamstring. Thank you very much. But, anyways, so Christian and I, we're going to discuss today a video from TikTok that I found this time. And man, before we keep going, I want to make sure I give the proper credit where credit is due. Drew Hoffman, that's who this guy is. He looks like, is that Drew? I don't know. Oh, that's the name on it. So I guess we're going with that. But, anyways, he put a video out on TikTok about doing ball kind of self manual therapy using a lacrosse ball on your feet to help loosen up ankles before and after runs. Right. Super interesting thing, Christian, that I just realized is that he keeps talking about the ankles in this video and he only uses the ball on his feet, which I'm not saying is like couldn't help, but like I just think that's kind of funny. Anyways, so he's claiming that if you use a lacrosse ball to roll out your feet before and after a run, that your tight ankles, your painful ankles, etc., are going to go away and you have nothing to worry about. So, Christian and I are going to discuss what we think about that and kind of what our thoughts are in terms of that manual therapy technique and doing around running and other things that we think could maybe be impacting. So, Christian, what are your initial thoughts on the video that I showed you?
Yeah, I don't know if he's a charlatan. I haven't watched any other videos by this person, but if he is a charlatan, he's not trying very hard. That's like it's an incredibly low stakes claim, but like also like a totally incorrect claim. It's kind of crazy. Yeah, just like try a little harder, please. But
Low risk, low
yeah,
reward.
jokes aside, I'm gonna assume that he's coming from a really good place, and this is something that's been really helpful for him, and he just wants to share it with the world. Oh, cool. In no world is massaging the bottom of your foot going to fix all of your ankle pain. Like, I think anyone watching that knows that,
Yeah.
but I just have to make sure I'm clear about that. Yeah, massaging the bottom of your foot with a lacrosse ball can feel really freaking good. We recommend it for people all the time that have plantar foot pain, plantar fasciitis, but it's a very small part of a more comprehensive approach. It's going to include a lot of other things that we'll get into.
Mm-hmm.
I will say, in his defense, that I personally have some soreness in my right foot. It seems to be from a tight joint. And the one thing that really helps it the most is stepping on that ball really freaking hard to get a self mobilization. And when I loosen up that joint and just push really freaking hard on the bottom of the foot, it feels a lot better. And it feels a lot better not just for minutes to hours, it feels a lot better for days. And if I do it more regularly, it keeps feeling better. And I've actually maintained a lot of progress just from doing that one thing, not adding any other things that we're going to talk about today. So there is a time and a place for it, I think, in isolation. But for
Mm-hmm.
most people that you're going to see in the clinic, or most people dealing with, let's say, ankle or foot pain, massaging the bottom of your foot with a ball is probably not going to do a whole lot.
Yeah. It could be a good additive, right? Like if you already have two, three other stable ideas in your plan of care. I mean, it's not the one thing is it's not going to hurt people, right? If you're massaging the bottom of your foot with like a lacrosse ball, like you're not going to do any harm to your body with it unless you were somehow standing on it
Sorry,
and you
that just reminds me of a patient I
fell
had
down.
not too long ago. I was seeing her for, she had some, seemed like it was like a piriformis syndrome type pain. So just pain in her buttock,
Mm-hmm.
pain around her sacrum, and I had her doing some foam rolling of her butt. And foolish me, I just assumed that she knew how to foam roll her butt because like I'm not going to spend forever teaching someone how to do that in the clinic. I don't want to insult them. And like a couple of weeks go by, and she's like, "Yeah, my tailbone is just so sore. I just like it's and the more I roll it, the more sore I get." I'm like, "Oh, interesting." So I'm screening her for like coccydynia. Are we missing something with a low back thing? And she ends up going to see the pelvic health therapist for a separate thing. And my pelvic health therapist colleague was like, "Hey, Christian, yeah, so about her sacrum pain, did you talk to her about how she's foam rolling?" And I'm like, "No, I didn't." And she's like, "Well, I did." And she is just rolling her tailbone back and forth, not even really getting her piriformis. And I just asked her to stop that, and her tailbone pain's getting better.
Just basically sat on the thing and just went back and forth.
Like, God dang it. Like, it's such a stupid thing to miss for someone. And my point
Yeah.
is that you can overroll something and actually make more of a problem. So the ball can be dangerous.
Ball can be dangerous. Let it be known. So maybe I take back what I said. go over it with your physical therapist and make sure that we're getting the right dosage and the right technique down. That might not be a bad idea. But no, I think it'd be a good additive, you know. I like to do that with patients where like we already have, you know, we're covering all of our bases in terms of like home program work, in clinic manual therapy, activity modifications, right? Education. And it's like, you know, I give them a lacrosse ball and they, you know, put in like their QL or something against the wall. And they're like, oh, that feels great. And I'm like, perfect. Let's just add this in. You know, it's a good additive, I think. And with that being said, I don't think it's the answer that's going to fix everything, though. What we know about this type of manual therapy and why it's likely working, at least to my knowledge and the extent of what I know, is that individuals that do this, they get that peripheral desensitization, right? So they get that nervous system to kind of calm down to that mechanical response or a stimulus, and that's the response they get is less pain because of it. But it's not necessarily something that's going to last or quote fix things, right?
Yeah, I think about this like I think about the rock climbing folks that I work with. So this guy in the video, he mentioned that he had been doing the ABC method, which wasn't
Mm-hmm.
really that helpful, but adding in the ball revolutionized his running. The ABC method, I'm assuming he meant like you're drawing the alphabet with his
I'm
foot
guessing so.
to get warmed up for a run. Like, are you serious? That's like me saying I'm gonna go before I rock climb. I'm just gonna like take my wrist and just do some wrist circles, and then oh, I'm warmed up. I'm gonna go climb really hard now. Like that's not how warming up works. It's not gonna do anything. And so like the first thing he was doing was highly suspect for any sort of possible benefit beyond grade one ankle sprain. And then he goes to the ball. So like he didn't he wasn't starting off very strong without the ball.
Mm-hmm.
So finding the right things to get warmed up is really important. But I do want to make sure we think about what the heck could be going on at your ankle. So, like when I hear that he's trying to treat his ankle pain, I'm like, okay, what is causing the pain? What are some different things that could be going on at your ankle? So I made a short list. I want you to add to it, Eric. But things that
Mm-hmm.
I think about whenever someone has ankle pain from running, I'm like, all right, we got posterior tibialis tendinopathy. We have peroneal tendinopathy, Achilles tendinopathy, insertional and mid-substance. We have plantar fasciitis or plantar heel pain. You might have a joint mobility restriction, meaning one of the many joints in your ankle or foot is stiff. And so when you go and you land and impact it, it's not sliding around as nicely as it should. And so it's just getting squished in ways it doesn't like. And we can loosen that thing up, it's probably going to feel a lot better. Then you might even have some gait pattern issues where maybe you had an injury many years ago and it led to you running funny. And now that running funny has caught up with you in altered biomechanics that are not putting stress through your ankle in an ideal way. And so if we can work on your gait pattern, your ankle and foot pain will probably go away. And then maybe you also have some cadence or force absorption issues. So if you're running and your cadence is like 140 or 150 with the goal being like 170, 180, you are putting a ton of force through your ankle and your foot with every single step. And we know you are more likely to have any kind of joint pain in that chain, your ankle, your knee, your hip. And so increasing your cadence can fix that just immediately. Or maybe you have a decent cadence, but you just step and land really hard, way harder than you need to. So you're just going to put undue impact stress on those joints. And if we could just stop that, you'll feel a lot better there too. And then one other one would be, do you have a shoe fit issue? Were you in Hoka's for a long time with tons of cushion and now you're going right to minimalist footwear? Or you the exact opposite, you maybe were in something a little bit more trim, but now you're going to something a lot thicker, which can be quite unstable. These really high heeled or high thickness shoes, they can be kind of tippy left and right, and that can make your ankles work differently and work harder and lead to a lot of fatigue in those ankles. But what do you think, Eric? What do you want to add to that list?
Well, I think you took all the good ones. That's what I want to say. No, I mean, I think you nailed it in terms of like, you know, what could be happening. Like 90% is probably covered there in terms of just a bunch of different stuff from overuse, mechanical work to poor fitting to just soft tissue injuries that can occur. A couple other things that I was thinking of while you're talking there is one, if we haven't ran much before or we're increasing our mileage, and we'll talk about this in a little bit here, like you might just be sore. You know, it just you might not be quote injured. You just might be sore because muscles and tissues aren't used to putting in the work that you put in. That could be one. I was going to say compartment syndrome, but
Hey, that's one.
I mean, it
Yeah.
could be. That'd be very serious and probably more rare, but it could be. Stress fractures could be another one if you're older. Well, it doesn't have to be older, but, you know, I think about like our 55, 60-year-old female postmenopausal, you know, low bone density, etc. That could be a different differential diagnosis. You know, shin splints, even though that's not necessarily like around the area that this video is talking about, a little bit higher up the chain there. And then, honestly, another one that could be going on that I think is a little bit more like, probably not. But like, it could be some type of like referred pain. It could be coming from more like quote up the chain, right? We could just have like a really weirdly missed like radicular pain, maybe. I don't know. Maybe we're just getting some weird nerve stuff going down to the foot, and you know it's just that sharp shooting pain, maybe some burning that we think is going on, and it could just be coming from more up the chain a little bit. But anyways, as Christian and I are speculating here, I think it's fair to say that there's many, many, many things going on that isn't just right there in the ankle, right? In that ankle or foot. There's many different things that could be poking their head out or being the reason as for the quote like pain generator. And so it's important that we talk about things other than just manual therapy because there's many other ways to go about treating these different things or working on these different things that quite frankly need to be in there because there's so many possibilities that could be going on. So one of the things, Christian, that I wanted to circle back on quick is we like rather than rolling out your foot or ankle, I would say let's take a look at your program. What are we doing? What have we been doing? What are we doing now? Right? When's the last time you had like a deload week? When's the last time you know, took a week off and did some active rest stuff, right? I'd be curious to know like how much percent increase have we been doing per week? Like were we doing like a gradual like 5%, 5%, 5%, and then for some reason the last 2 weeks you jumped up like a 20% increase? That's probably where, you know, we could take a step back and probably see improvements in your symptoms. So I think a lot of it is just can come down to programming and overall volume, and not just volume within a day or a week, but looking at volume in terms of like those mesocycles. So months long, right? Like I said, when's the last time we took an off week and did some active rest?
Yeah, I think that's a really nice segue to the major point here is what's going to really help with your ankle or foot pain. And I do want to stay on your topic of running intensity, running volume, or dosage issues. That to me is the most important one. It is the least sexy and it is the one that most people, meaning like most patients, don't think about. They're just like, I am going for a run, or I got back into running and I just started doing stuff. And the biggest one that I've found is the running intensity. For some reason, culturally, we have it in our heads that if you aren't busting your ass, breathing really heavy, working super hard when you run, you are not running right. Like
Yeah.
you're not getting your money's worth. And you are not doing the exercise correctly unless you're working that hard. And that is like if I could change one thing about the mentality of running in at least in our country, it would be that. It's like this need to work super hard when you run. Yes, there's a time and a place for that, but if you're getting back into running or you're progressing over time, you need to be mindful of how hard you're running. So on that like RPE scale, 0 to 10 difficulty scale, most of your running, especially if you're newer, should be at no more than a 6, maybe a 7. If your heart rate is like at 80, 90% of its max and you're just like working an 8, 9, 10 out of 10 effort and you're just doing that consistently, you are asking to get hurt. It's just it's not sustainable. Your body is not adapted to it. As Eric said, you're just getting sore from working your body in those ways again. But if you keep doing that again and again over multiple runs, multiple weeks, that leads to a mismatch between recovery and progression. and you're going to end up just dipping way, way too much into this like under recovered state where you're going to end up getting all these different chronic issues like tendinopathies and bone stress
Mm-hmm.
injuries. And then just like tissue overuse, things just get really tight and sore because you're beating the crap out of them and they need a bit of a break. And so for me, running intensity is like the number one thing. Running volume, yes, people do tend to progress too quickly. They go from 5 miles in week one to all of a sudden they go 15 miles in week two. That's way too big of a jump for most people.
Yeah.
And you're just asking to get hurt. But overall, I think intensity and volume need to be talked about first whenever thinking about someone's ankle or foot pain.
Mm-hmm. Yeah. Yeah, I'd agree. I'd agree. Quick side note, then we'll get back into it. As you were talking, I saw this last night on social media, and I just want to bring this up. Kind of related. There is a run club in Minneapolis, and it's like, is it Embrace the North or something like that? I forget what it is. But basically what they do is they start at like this gym, and you don't have to be a member to do it. It's for members and non-members. And you run 2 miles to the Mississippi River. They they shovel out holes in the ice. You do like a 3 minute, 5 minute, whatever ice bath in the Mississippi, and then you get back out, dry off, and then you run back to the gym, and then you do like sauna sessions. And I'm like, running in negative, sub-zero degree weather sounds terrible. The polar plunge sounds terrible. I kind of want to try it out. There's a part of me that kind of wants to try it out. But
I'm sure it
anyways,
feels nice.
that's
Like, yeah, I mean, that stuff's useful.
just a total side note.
Total side note, yeah. Can't say it's going to cure your ankle pain, but might distract you from it pretty well.
Right. Anyways, okay, getting back to it. So, yeah, I think so. We talked about the proper programming. We've discussed shoe wear, like you said, Chris. If you're going from a very thick supported shoe to a minimalist or vice versa, right? That can also be the case. A very narrow toe box to a wider toe box, whatever it is. There's different variables that can be switched, that can be taken into account when it comes to shoe wear and what you're doing with that. But we also talked about form a little bit. And so cadence, strike pattern. Maybe you need a different strike pattern. Not necessarily saying that like one's better than the other, but like what fits you best. Those things are all important as well. But I would also just say like a consistent routine that is more active in regards to like stretching and strengthening when it comes to the lower extremities and working everything up to the hips and the trunk all the way down to the ankles and the intrinsic foot muscles. I think that they're all beneficial, they're all useful, and doing mobility stretches that are not just open chain but also closed chain stuff, right? Knees over toes stretches, all those great things. So I think it's important that we can, get a routine that's not just more the passive stuff, but also keeping in mind the more the active stuff as well. And I don't think we necessarily have to get into any like specifics because I think it's, there's just so much out there in terms of like what exercises are the best? Is this exercise the best? Is this stretch the best? What's going to give me the best bang for my buck? And it's like honestly, probably just a handful, a mixture of 3 or 4 of those and do them consistently, and you're probably going to be good, versus like this one exercise that's going to unlock your ankles. You probably just need a couple of each and just do them consistently, and you're going to be fine. And if you chose these 3 versus these 3, you're going to be okay. If you choose these 3 instead of these 3, you're probably still going to be okay. So I don't know. I don't think it's like there's one specific exercise that's like your golden ticket to successful running.
Absolutely. And staying on topic of how to fix this ankle pain instead of just using a ball.
Mm-hmm.
And when we think about why does someone have ankle pain, it's really only one of two things. They are either not strong enough or don't have enough endurance to do what they're doing in that moment. And so they have way too much fatigue, or they are just beating the crap out of themselves for too long a period of time. Like you mentioned, Eric, taking a deload once in a while to flush out some of that recovery that's happening in the background, or sorry, some of that fatigue that's happening in the background to get sufficient recovery. So as long as you think about your problem from those two different perspectives of like, am I strong enough to do this right now, but also am I just doing this for too long? Then how do we solve those issues? Well, to make running more sustainable, we need to make sure that you're doing it decently well. That's where the running biomechanics come in. That's your cadence, that's your strike pattern. Even your footwear to some degree is helpful for that. But then how do we make you more resilient and better able to handle those forces of running? That's where that comprehensive strength plan comes in handy. And like, I'm not saying that you have to do one to be a successful runner. I'm sure a lot of runners that are out there, especially elite level runners, don't do much strengthening at all. They just run a crap ton. They're the outlier. That's not you. That's not me. That's none of our patients. We're not those people. We don't plan for that.
Yeah.
So we're trying to think about what the hell do we have to do to be as healthy as we can and be better able to handle those forces of running. And that's where having, in particular for the ankle, an ankle specific strength plan, I think is really useful. So some kind of calf raises. It could be tibialis posterior raises. It could be single leg calf raises, things like that, especially with the deficit. Those are going to really help strengthen not only your calf Achilles tendons, but your posterior tibialis tendons, as well as your peroneal tendons, all the ones that need to handle that ankle stability and propulsion. And so if those are stronger, you're going to feel a lot better. And also the calves are vital to running performance. I think the calves go underlooked. People think mostly about like the big hip muscles and the thigh muscles. Calves do a major amount of that force recycling, especially the Achilles tendon complex, force recycling to help propel you. And so if that's not robust enough, you are leaving gains in the table and you're setting yourself up for injury risk. So focusing on that kind of strength, but also the springiness of those tissues, I think that's really important. So some level of plyometric training can be really useful, and we do have very good evidence to suggest that for reducing running related injury as well as improving running performance. I've looked at comparing strength plans versus plyometric plans, and there's evidence on this that compare these head to head. They come out about equal. If you just focus on some jumping training versus some strength training, you're going to get really good benefit. But if you do both of those things, way more benefit, way more bang for your
Hmm.
buck. And so I think having a mix of that is going to be good. And then if you can just up that a bit higher to the knee and the hip with, like you said, Eric, a couple single leg strength things like a lunge or a Peterson squat or a single leg Romanian deadlift, do that a couple times a week, you are going to set yourself up with a really strong foundation to help prevent a lot of that ankle pain. So mobility work, I think, does have a place. Like if you really severely lack ankle mobility, especially in terms of dorsiflexion, that's a problem. You should work on that with some calf stretching, some soleus stretching. That has to happen. But by and large, people don't usually have a major mobility restriction in the ankle or the foot that's causing their pain, unless they're like
Hmm.
highly sedentary, middle aged or older, and are trying to get into running now after 2 or 3 decades of not doing it. All right, fine. We got to look at your mobility. But for the average like teenager to 40 something, probably not as critical to think about for you.
Yeah. Yeah, and I'll add in there too, like post surgical as well. If you're like trying to get back
Totally.
something after surgery, yeah. I had that be the other caveat there. So yeah, anyways, I mean, I think I think we did a pretty good job there of highlighting not just the different various things that could be going wrong, but also how there's much more to just, the mechanical stimulus of manual therapy to help individuals, improve or reduce any running related injuries or soreness. And so I think that's, I don't know, I think that's the end of my list there, Christian. In terms of my talking points, is there anything else that you wanted to touch on when it comes to diagnoses or treatment or anything like that around ankles or running?
Yeah, I mean, if we could redo his video to say like this one thing to cure your ankle pain, I would say the first thing I would start with is check yourself. Are you just
Mm-hmm.
running too hard and too fast for what your body can do? Are you just trying to be a bull in a china shop and just keep progressing your running without listening to your body and pulling back when you need to? Those things are like the lowest hanging fruit possible. Just ease up on that crap. Make sure you're giving your body what it needs right now and not trying to force it. And the gains will come. You will get better because it's not really constructive to try to push through all that stuff. Because what's going to happen is you're going to end up getting hurt. You're going to end up getting really sore, and you're going to get discouraged and you're going to stop running either because of an injury or because you're tired of being sore. And then all the goals and the benefits and all that stuff that you've had, they're just gone because you just couldn't save yourself from yourself. So ease up.
Mm-hmm.
The pride isn't a thing, and just focus on making the running more comfortable. And then if I want to add one more thing to that, increase your running cadence. Whatever it is, try to make it a bit higher. Aim for that 170 to 180 cadence over time. If you're running at 4 miles per hour, probably not going to hit 170, but as you get a bit faster, you will. Doing that kind of stuff is going to really give your ankles and your feet enough time to adapt and just reduce how much you're freaking beating the crap out of them. It's
Mm-hmm.
quite astounding how much easier running can be at the same speed and the same distance by adjusting your cadence. A higher cadence is just easier, and so you should do that. And focusing on that stuff, I think, is the most important. Then, if you want to do a little bit of lacrosse ball massage at the bottom of your foot before or after, just because it feels nice, go ahead. It's not going to hurt anything.
Yeah, yeah, I would agree. And I also one more thing that I thought of or brought up when you mentioned the check yourself too. If we want to get a little bit more broad with how we're approaching this topic and get out of just the biological, but also look at like the psychosocial as well. Like if you're just having like a really stressful week, let's say a week at work, or you got some personal issues going on, whatever it is, if we're abiding by more the biopsychosocial model, that would say, hey, the body, the nervous system tolerates stress to a certain amount, and stress is stress no matter what kind it's coming from or where it's coming from. And so, yeah, if you're having just a tough week or a tough couple of weeks at work or something, or you got some personal stuff going on, like, you know, things like running or a low intensity cardiovascular program can be great for stress relieving. So, like, keep it. But if this was your week to go, you know, 80, 85, 90%, or really push it, like, maybe try and save that for next week. Just do a nice little 60%er this week, do some more active rest stuff, because we know that there's a chance that we could see some type of pain or discomfort come up if we have greater stressors outside of just the biological. So that was the other thing that popped up. I was like, oh, that'd be good to talk about. Let's bring that up. So,
I think that's really important because myself as an example, we just had
mm-hmm.
our first kid 2 weeks ago.
Yeah,
My last run was just a handful of days before that, and I have been not sleeping very well, not eating very well. I haven't touched a weight in 2 weeks. I haven't been climbing.
yeah,
I've been doing dad stuff. And I
that
even,
stuff.
dude, going downstairs, it was 2 days ago, going downstairs first thing in the morning, I felt a little pull in my calf. Swear to God, I was like, no, this can't be. I,
Has one kid, now you're
right,
going.
dude, right. So, like, I am not going to go out and run a hard, like, 6 miles today if I want to go for a
Yeah,
run, which I do actually want to go for a run after this. I'm going to probably try to run like 2, maybe 3 miles at most, much slower than I had been 3 weeks
mm-hmm.
ago, and just see what happens. And maybe taking some walking breaks if this calf is annoying or I'm getting kind of gassed because I don't have the recovery right now from lack of sleep. And
Mm-hmm.
just knowing that
Absolutely.
about myself and my circumstances, and knowing that the fitness I've developed over the last couple of years from running is there. It's just a bit dormant right now because of the change in my cycle here, but it's going to come back. Swallow the pride. There's no reason to force it. I'm not trying to get hurt right now.
Yeah, yeah, it's a good point. It's a good point. Yeah. Well, I think took about 30 give or take minutes there. Listed out very broad strokes in terms of how you can rehab ankle soreness when running, but clearly shown that, the crossball can be good. Adding some other stuff in is probably better. Anyways, well, thanks so much again for that discussion there, Christian. And hey, man, congratulations again on the birth of the child and being a dad now and just killing it over there.
Thanks, man. Appreciate it.
But all right, dude. Well, until next time. Chat
Later.
later. See ya.